Veterinary medicine is a messy business both physically and emotionally. Vetsplaining is one veterinarian's attempt to explain and understand her own profession a little better. Join Dr. Lisa McFaddin as she delves deep into the medical and business aspects of veterinary medicine.
You've made it to part 4 of A Day in the Life, and by now you've probably realized that there's a lot more going on than initially meets the eye when you walk into a veterinary hospital. It's not just the veterinarian that plays a crucial role in your pet's care. The whole team is extremely important. And in this episode, we're going to talk about the veterinary assistants. Now, in a lot of states, there is little distinction between being a veterinary assistant and being a veterinary technician. In Virginia, you have to be licensed to be considered a veterinary technician, and we call them LVTs, or licensed veterinary technicians. And veterinary assistants are generally individuals that have received on-the-job training. A lot of them start out as kennel assistants, and then they start mastering certain skills, in particular holding animals, so cats and dogs, in my case, because I don't really see exotics. Holding cats and dogs is a really big deal, and it's actually a lot harder than you would think. A lot of it boils down to being able to read the pet and knowing their behavior and knowing when they're scared and knowing when you need to hold a little bit more or you need to hold less. And most of my veterinary assistants are kind of animal whisperers. I mean, a lot of them can walk into a room, or even before they walk into a room, they can pick up on an animal's anxiety level, the owner's anxiety level. And so my assistants are generally the ones that load my appointments for me. And when they come back, they often tell me about the pet's personality, as well as if they think that the pet is stressed or if there's a caution. So it helps kind of set the tone. And it's not that I want to walk into the room and be on guard because the pet is anxious. It's actually the exact opposite. I want to know that they're anxious so that we can approach them from a standpoint that kind of calms them and relaxes them so that we don't have to push too hard and it doesn't make that vet visit worse. Because a lot of times if you push an animal and they're already scared, it's just reinforcing their negative thinking about the visit. And so it just kind of compounds. Every visit becomes more and more stressful. And then that's when you start getting issues like fear biting or growling, or in the case of cats, being a very frustrated kitty. So our goal is really to help ease them as much as we can and to make it as painless as possible. And I'm sure you wondered where I was going on this tangent, but that brings us back to our veterinary assistants. I mean, in my case, we have mostly female veterinary assistants. I think we now have one male veterinary assistant. The veterinary profession is very female dominated these days, in case you had not noticed. And they are all very good, and they have to be very good at reading pets and restraining. They also are very skilled at helping hold during the appointments. And the way the normal routine works is, if I have an appointment, my veterinary assistants go in, they bring the animal in the room, they weigh it if it's big enough to weigh on the large dog scale. They open up the electronic medical record, they obtain a brief history. So this is what we call the presenting complaint. So it could be a wellness exam. So in our pets younger than 8 years of age, for canines, we do wellness exams annually. In cats, that's less than 10 years, we do annual exams. And then in dogs older than 8 or cats older than 10 years of age, we do exams every 6 months. So this is part of the opportunity for the veterinary assistant to obtain as much of a history as they can. So how has Fluffy been doing, eating, drinking normally, any vomiting, diarrhea, coughing, sneezing, attitude the same, energy level the same, any change in urination, defecation, any change in appetite. And that kind of just sets the tone. They also get those nitty-gritties that a lot of times veterinarians just kind of blow right by, such as diet, which is very important, heartworm and flea and tick preventative, and then any medications or supplements. A lot of times veterinarians kind of go into this mode of, walk in the room, greet the dog or cat, greet the owner, examine, discuss problems, move on. And so having the assistant go in and their sole focus is making sure we get a well-rounded history, making sure we document medications and preventatives and diet, that really kind of helps focus the veterinarian, especially if there's any issues that maybe would not have necessarily been brought up initially, but because we have that first person that goes in, and then at that point, the veterinarian afterwards comes in and the owner's telling us a more kind of like selected history, it lets them kind of trigger memories. So let's say they say to the assistant, oh no, Fluffy's had no vomiting. And then the assistant leaves the room, tells the veterinarian about the case, the veterinarian walks in, and then the owner will say, well, now that I think about it, Fluffy has been vomiting once a month or so for the past 6 months. And it's funny because a lot of times the vet assistants get frustrated because they're like, oh, I just asked that question. And when I was a fourth-year vet student, the same thing happens. You go in, you talk to the owner, and then by the time the clinician comes in, the story's changed. But it's not really that the story changes. It's just more, a lot of times we'll create this kind of internal list of issues when we go to the vet, or if we're going for like a quote-unquote wellness appointment, we think, oh, we're fine, we're just getting shots. But having those initial questions and then letting the client think about it for a few minutes before the veterinarian comes in actually really helps kind of jog the memory. So the assistants go in, they obtain what's called a TPR, temperature, pulse, respiration, and the weight. They get a brief history, they get the medications as we discussed, and then they let them know that the veterinarian's going to come in and talk to them. In the case of our wellness appointments, all of my veterinary assistants are required to know our wellness protocols. So we do it by life stage. So we have, puppies, kittens, adults, and then seniors. And we created this brochure that kind of breaks it down by life stage and what we recommend at each wellness appointment. But the assistants are required to know the vaccines we use, why we use them, what they protect against, why we recommend heartworm testing, why we recommend blood work, why we recommend flea and tick and heartworm prevention, and thyroid testing in the case of older kitties as well. And this allows them to help educate clients, to have that initial conversation. And sometimes that conversation goes a little bit more smoothly when it's not the veterinarian, because the clients don't feel rushed, the veterinarian doesn't feel rushed, and sometimes they actually feel a little more comfortable asking questions that they may not want to ask in front of the veterinarian, such as, so my dog's been getting this Lyme vaccine for 4 years, but I don't really know what it's for. Sometimes they're either hesitant or embarrassed or just shy and don't ask the veterinarian, but they're more comfortable discussing it with the assistant. So in my mind, this really helps engage my assistants. It makes them feel like they're contributing more. It makes them feel engaged. And I really think knowledge is power. So the more they know and the more they can utilize in that exam room, the happier they are, the better the work environment, the better the care we can provide to our patients. So the assistant loads the room, then they come find the veterinarian, and they're required to do what's called basically like rounding the case. So they present what's called a signalment. So for instance, we'll use Fluffy, my imaginary animal. So they would say Fluffy is a 6-year-old male neutered Kishund that presented for a wellness appointment. And that's the signalment. So that just tells us the name, the age, the sex, if they're neutered or spayed, and their basic problem. And then from there, they'll discuss what the owner talked to them about. The veterinarian will kind of read what they typed as they're talking to the owner, and then the veterinarian can go in with more targeted questions. In the case of my integrative appointments, a little bit different because I have this whole series of questions that I ask for integrative, which we'll talk about in another podcast. But this really lets us set it up. So then when we're in the exam room, the assistant is responsible for helping to hold during the exam, because we are an AHA certified clinic, which we'll talk about in another podcast. We are required to have an assistant in the exam room while we're doing the examination of the pet. And it's not because we don't want the owner to hold. A lot of times pets are a little more anxious if they're being held by their owners because it's a weird environment. From a legality standpoint, if a client is holding their pet and they get bit while they're in the exam room, it's actually my fault. So it's actually the veterinarian's fault. And so then they're liable. Whereas if the assistant gets bit, which obviously we try and avoid, it's then, workman's comp at that point. But we have to take that liability out, unfortunately. And so that's part of the reason that we have the assistants hold. So we do our exam, we come up with a plan, and then let's say we're going to check the ears. So the assistant will frequently get swabs. They'll make a slide, which we can talk about that in another podcast as well, all about ears. Yay. And then a lot of times they'll read the slides for me, or we're in the process of teaching them how to read the slides, and they help to draw up the medications, draw up the vaccines. They get medications that I'm prescribing ready, and then they will discharge the patient. So once the veterinarian has come up with a treatment plan, they discuss it with the owner. Then once the medications are filled, the assistant walks back into the room and then reiterates everything the veterinarian said and then goes over the medications. That way it helps to... repetition is what really helps us remember things. And I think they've done several studies that have shown that you remember 20% of what someone tells you in the exam room. So in my mind, if it's repeated at least twice, that maybe you'll remember 40%. So that kind of increases our odds of compliance as well as improved patient care. And then aside from the appointments, the assistants are utilized heavily for frequently blood draws, for assisting the licensed technicians with IV catheter placement, and for anesthetic monitoring. So because we're an AHA clinic, every patient that undergoes anesthesia has to have a technician monitoring them. And what we can do is, in the instance of doing spays and neuters or mass removals or other surgeries, the technician will be there helping to oversee the assistant who's doing the physical monitoring and be there if there's questions or problems, but then that also allows them to prep the other animals. In the case of dentistry, the technicians are the ones who are doing the cleanings, the veterinarians are the ones who are doing the actual dental extractions, but while the technician is cleaning, the assistant is monitoring the anesthesia, and then the veterinarian is there as well. So realistically, like every patient that undergoes anesthesia in our practice gets 3 people monitoring them at all times, which if that was me and my pet, I would be a lot happier knowing that there's multiple people. So if there's a problem that arises, you have more hands, you have more ideas, and it's a faster response time. The other hat that our assistants wear at the clinic is that because we do offer boarding, they then help the kennel assistants to walk dogs midday, take care of dogs. And then our assistants are the ones that medicate, our assistants and our technicians are the ones that medicate our boarders. So a kennel assistant has to undergo special training in order to give medications to a pet that is staying with us. And Michaela, who you heard in the kennel assistant podcast, she is approved to administer medications because she's undergone this training. But a lot of times, especially if we have college-age kids that come in and clean and walk, we want to make sure that the vet assistant who knows the drug, who knows the dosing, who knows why they're supposed to be getting it, is administering it. It just increases the level of safety for our pets. So now we're going to listen to 2 of our veterinary assistants. We're going to listen to Sarah and Jessie, and they're going to tell us about kind of a day in the life of being a vet assistant, what they like, what they don't like. And what's interesting to me is that most of my employees, when I ask them, what's your least favorite thing, a lot of them say euthanasia, which euthanasia is very sad, and it is unfortunately one of the harder parts of our job. And for me, I look at it as being able to ease suffering. I look at it as helping an animal transition from this plane of existence to whatever you believe in a humane and peaceful fashion. I think, as hard as it is for me to admit, I think that I've kind of gotten a little calloused towards it over the last 12 years that I've been practicing. I really honestly do not know how many animals that I've had to euthanize, but for me, in order for me to be able to deal with it and not have it be emotionally crushing, I have to distance myself in a sense, and I have to kind of look at it more clinically. You know, was this animal suffering? Was I able to improve their transition process? Was I able to help the clients through this transition process? And in vet school, we get a little bit of empathy training for euthanasia, but not, in my opinion, enough. Overall, in vet school, I think that they really need to improve things like client communication courses and, empathy courses, but they're so focused on, you have to learn all the medical knowledge that it doesn't leave a lot of time for other areas. But I digress. So going back to the euthanasia, and the way I try and do it for euthanasias is we have the owner come in, we have a blanket in the room, assuming they want to be present, and then there's a little bit of paperwork they have to fill out, and then we have them check out so that it's just done, it's over with. And then I walk in, I discuss the process of euthanasia, which I'm happy to do another podcast on if we want to, I guess, be a little more cryptic. And I discuss the process, and I place an IV catheter in every patient that I euthanize. It makes it easier. It is straight access to the vein. It reduces the risk that while you're giving an injection, there can be error. And I frequently give them a sedative. And what I'll often do is I'll borrow the pet, take them to treatment where we place the catheter. If they're a large dog or the owner wants to be present for the catheter, which is totally fine, then we do it in the room. And so frequently I'll have my licensed technician place the catheter and then give the sedative. But then for the actual euthanasia procedure itself, it's just me and the owner. The only time that I've ever done it differently is if the owner does not want to be present and or it's an aggressive animal and the sedative just wasn't enough. But the reason that I do that is I think that euthanasia is a very intimate procedure. And, it's really that kind of ending of that bond or that changing of that bond between the owner and the pet. And I don't think the assistant needs to be a part of it because I think part of what makes our veterinary assistants so amazing is just the compassion, the emotion that they have for the profession.